Maybe. Ladies and gentlemen, esteemed participants, very warm good morning to all, one and all. I am Salsana, uh, Department of Mental Health Nursing, Sri Anjanaya College of Nursing. Welcome you all for today's webinar on Mind Matters, isn't it? Of course, mind matters, enhancing mental well being in nursing education and practice. We are so delighted to have you all in this webinar to discuss about methods to enhance mental well being in nursing education and practice. Today, we will be exploring a wide range of topics including from stress to strength and nurturing resilience. Today's webinar is brought to you by Sri Anjanaya College of Nursing, functioning under Sri Anjanaya Medical Trust, established in 2011. Is attached to Malabar Medical College and Research Center, which is 89-bedded super specialty hospital. The campus situated 22 kilometers away from Calicut City, Kerala. Before we begin, a few reminders. Please ensure your microphones are muted to avoid any background noise. If you have any questions during presentation, feel free to type them in the chat box. We will address them during question and answer session at the end. Before we begin, let us take a moment to seek blessing and good fortune for today's event. Let's begin this program. Let me call Mrs. Adulya KV, Assistant Professor, Department of Mental Health Nursing, Sri Anjanaya College of Nursing, for the welcome address. Welcome you, ma'am.
A warm good morning to all. I'm very pleased to be here today for the opening of this national level webinar on Mind Matters, Enhancing Mental Well-being in Nursing Education and Practice. It gives me an immense pleasure to start this auspicious occasion by heartily welcoming everybody. First, I would like to express our sincere thanks and regards to our patrons and backbone of our institution, Mr. V. Anil Kumar, Chairman, and Mrs. Sudha Anil Kumar, Secretary, Sri Anjanaya Medical Trust, Malabar Medical College Hospital, and Research Center for the delightful support for the organization of the webinar. I am really grateful to our respected principal, Dr. Professor Jolly George, for whose encouragement and support has always helped us to achieve our milestones. Welcome you, ma'am. I would like to warmly welcome our resource speakers who have generously agreed to share their expertise with us. Famous academician and researcher Dr. Binil V, Additional Professor, Department of Mental Health Nursing, Manipal College of Nursing. And an eminent resource speaker in India, Mr. Jason Joseph, Assistant Professor, College of Nursing, AIIMS, Hyderabad. Hearty welcome, both of you. Next, I would like to welcome our beloved Vice Principal, Professor Rekha T, and other faculty members in the Sri Anjaneya College of Nursing. They provided the unconditional support and guidance. I feel extremely glad to welcome all delegates to this much awaited national level webinar. Welcome you all. Last but not the least, once again, I welcome each and everyone for this national level webinar. This will be an opportunity for us to learn from each other and grow together. Thank you.
Adulya, thank you for your welcome speech. Next, with great anticipation, we now look forward to the presidential address from the visionary leader of our institution, Dr. Professor Jolly George, Principal, Sri Anjanaya College of Nursing. Your words have the power to ignite the flame of curiosity and inspire us to strive for greatness. With respect, let me welcome our Principal Madam for inaugural address. Welcome you, ma'am.
Good morning, everyone. I am honored to welcome all of you to this important webinar on Mind Matters, Enhancing Mental Well-Being in Nursing Education and Practice. Mental health is a critical aspect of overall well-being, and it is especially significant in the field of nursing. Nursing students, faculty, and staff nurses often faces unique challenges and pressures that can impact their mental health. Therefore, it is essential to provide them with the knowledge and tools to maintain and enhance their mental well-being. This webinar, organized by the Department of Psychiatric Nursing at Sri Anjaneya College of Nursing, aims to address these challenges and promote mental health awareness and resilience among our nursing community. By focusing on mental well-being, we are not only supporting the personal health of our nurses, but also ensuring they can provide the highest quality care to their patients. Firstly, I would like to extend my heartfelt gratitude to our distinguished resource persons, Dr. Binil V, Additional Professor at Manipal College of Nursing, and Mr. Jason Joseph, Assistant Professor at AIIMS, Hyderabad. Your expertise and insights are invaluable to us, and we are privileged to have you with us today. I would also like to express our deepest thanks to our patrons, Mr. Anil Kumar V and Dr. Sudha Anil, whose unwavering support has made this webinar possible. Additionally, a special thanks to Mr. Matthew, Nursing Officer at AIIMS, for his instrumental role in arranging our esteemed resource persons. I'm confident that today's discussions and presentations will be enriching and will provide practical strategies to foster mental well-being in our daily practice. Thank you all for joining us today. I look forward to an engaging and insightful sessions.
Thank you, ma'am, for your encouraging words. As we start this journey of knowledge and collaboration, it is my honor to introduce our esteemed resource person for this session. Today, we have the privilege of welcoming Dr. Binil V, Additional Professor, Department of Mental Health Nursing, Manipal College of Nursing, Mahi, Manipal. He did his diploma in nursing from Government School of Nursing, Kozhikode, Kerala. Post BSc MSc in Mental Health Nursing and a PhD from Manipal College of Nursing, Mahi. He has also received a master's degree in applied psychology from Madras University, Tamil Nadu, and postgraduate diploma in psychological guidance and counseling from Manasa Educational Foundation for Mental Health, Shivamogga, Karnataka. He has over 35 peer-reviewed publications in area of nursing. He is currently involved in funded project from the Indian Nursing Council, Medical Research, Ministry of Social Justice and Empowerment, and the Ministry of Human Resource Development, Government of India. Dr. Binil is a life member of TNAI, NRSI, and ISPN. He is currently the deputy member of Secretary of the Institutional Ethics Committee of Kasturba Hospital and Kasturba Medical College, Manipal, and currently he supervises 6 PhD scholars. Welcome you, sir.
Thank you for the royal introduction. Can we start now?
Yes, sir, of course.
At 15, yeah. I'll share my slide. You can see my screen?
Yes, we can see, sir.
Infinity mirror.
Yes, we can see, sir. We
Yeah,
can.
full screen. Is it full screen? Slide mode?
Yes,
Is
sir.
it in the slide mode?
Yes, sir.
Yeah, thank you. So, hearty welcome to all of you. I take this opportunity to thank the management of Anjaneyya College of Nursing, especially the principal, madam, for this great opportunity. I am also grateful to Mr. Matthew, Senior Nursing Officer and Patient Coordinator of AIMS New Delhi, who has given me this opportunity. So I have accepted this invitation because of his request. So when I talk about resilience, I'm going to talk about resilience in nursing. So I have accepted this invitation as part of my resilience building strategy. So this is the third time Matthew is requesting a session from my side. First chance I rejected, second also I rejected. So third one, if I reject, next time he will not call me. So that will affect our relationship. It will affect the professional connectivity. And of course, when I accept the sessions, I can develop myself, right? So these all are part of resilience building, and I'm trying to connect with my topic. So the outline of my presentation, this is the brief of my presentation. So basic things of resilience. And I will be emphasizing on resilience building among nurses and nursing students. So you have mentioned both nursing education practice. So I will be touching more of nursing practice. Still, I will discuss some of the points which is more relevant to the nursing students. And of course, we'll discuss how to evaluate resilience behavior and what are the scope of resilience and what are the opportunities available related to this area. So I just put the first slide as what are the different ways to enhance well-being among nurses, because the theme of the national webinar is enhancing mental well-being among nurses. So whether the participants are able to unmute and talk, so it will be nice if you can talk. Could you please contribute some of the points? What are the different ways to enhance well-being among nurses? Otherwise, online sessions are boring. Is it possible?
Participants, please join with us.
Yeah, please.
You want interaction section.
Yeah.
You can unmute and Communicate with the presenter.
Yeah, please unmute and talk. There is nothing right or wrong. You can talk. We are talking about resilience. If you are not talking, the resilience building will not happen. Anyone?
Good job situations.
Yeah, very good. Once you talk, please unmute again. Sorry, mute again so that other person can contribute. Anything else?
I think we have to enhance the confidence among the nurses.
Very good, madam. Very good. Anything else? At least one more response. Okay, maybe you can contribute the next slide. So I put I think around 7 evidence-based strategies. These are simple strategies. Okay, so it doesn't mean that these are the best practices. So based on the evidence I just listed out, which is more practical. Encourage your staff to exercise regularly. This comes under self-care. Self-care is very, very important in resilience building. Again, encourage your staff to eat healthily. That is again part of self-care. Foster better communication. Okay, start resilience training. That is what we are here today. Promote self-awareness and emotional intelligence. Always this communication, emotional intelligence, promoting self-awareness go hand in hand, always connected. So how we communicate also make a difference. So I will give you one example which I have done a mistake when I am attending an interview. This was happened in Calicut, so I don't want to name the hospital or the things. So when I went for the interview, the first question was, did you work in this particular institution? I said, yes, sir, I have worked. So which department you were working? So I said, I was working in the emergency department of your esteemed institution. So next question he asked me, how will you improve the casualty department of our particular hospital? So I started telling the casualty is very crowded. Most of the time the nurse patient ratio is inadequate. We will be busy full time and we will not get time enough time to even to stand 1 minute peacefully. So when I said that particular statement, one of the interview panel asked me, oh, you don't want to work. That is the reason you shifted from nursing practice to nursing education. So I was totally disturbed with that particular statement. In fact, I was planning to tell that even though it was crowded, I enjoyed working in that particular institution. But in between, he catch up that particular negative statement and he pointed out something else. So this was happened in 2010 or something. But quite a long period of time, I was quite disturbed with that particular answer and the response from that interview panel. So when we communicate also, we should be very careful. So most of you are from Kerala. So I can quote a recent incident which has happened during a memento giving ceremony, right? So it was a great news in the newspaper. What happened in that particular incident? So one particular person is giving a memento to another person. So when we are receiving a memento, there is some social norms, right? So that is violated as perceived by the public. So the public was against that particular person and a lot of issues was going on. So we should be very careful when we communicate. Emotional intelligence is very important. Our self-awareness is important. So all those things will make you happy. So I will move on to another situation. Definitely, I want your input from this situation. So let us discuss this scenario. Miss Y is a nurse working in the surgical ward for the last 10 years. She is an expert in managing post-operative patients. Suddenly, she received an email from the nursing superintendent to shift her duty from the surgical ward to a cardiology ICU with a short span of time. Okay, so the nursing superintendent sent a mail saying that within 2 days, you have to shift from post-operative ward to cardiology ICU. Unfortunately, Ms. Y is not confident about working in an ICU as she is not skilled enough to take care of cardiac patients. So what is the scenario here? Miss Y is working in post-operative ward for n number of years. She is very comfortable there. She is very safe, happy, no problem. But suddenly she get a mail from higher authority saying that you are shifted to cardiology ICU. But she don't want to go there. What is the reason? She is not confident to take care of cardiac patients. So my question here, what are the different ways the nurses or the Miss Vice of India react to this situation? So I want your thoughts. So you can please unmute and give your response. Here also there is no correct response. There is no wrong response. I just want your thoughts.
The nurse can approach her senior in charge
Very
and
good, ma'am. Yeah.
uh, approach and ask, explain about her condition, what is her hesitation to
Okay.
go. And because
Okay.
it's a sudden change, she was working so many years in particular unit. She's very expertise in that particular unit.
Okay.
Sudden changes, definitely it makes a lot of
Yes.
anxiety towards changes in her position.
Yes. Yes.
So she can go and explain about her situation. She can ask, like, I need some training to undergo or some
Yes.
time to adjust with
Yes.
that
Yes.
places.
Yes. Very good, ma'am. So ultimately, madam is telling you accept it, but request for some time to adjust to that particular environment. Maybe request for some special training before reaching there. Very good. Any other idea? Anyone else? Okay. So as madam suggested, this is what most of the nurses do in a well-established hospital. Think about a small hospital in a urban setting. For example, Bangalore. If it happens in Bangalore, a 20-bedded or 30-bedded hospital, what will happen? That particular nurse has enough opportunity to move to another hospital. So immediately she will decide tomorrow onwards, I am not working with you. I'm moving to another hospital. So this is also happening in the present scenario. So most of the time, the two responses, either leave the job and join into another hospital, or go and join in the cardiology ICU and try to adjust with that. So the point here you have to note is, both the cases you have stress. If you are resigning and joining in another institution, there is stress. If you are going to cardiology ICU and start working there, there is stress. Okay. So both the situation we cannot avoid stress. So we have to bounce back in both the situation. So what are the difficulties faced by the nurses in the present scenario? Can anyone list out some of the difficulties faced by the nurses in the present scenario?
So
Yeah,
anxiety and depression related to their work pressures.
very good. Work pressure, anxiety, depression.
And even according to the hospital norms, they are not able to provide the best facilities to the patients and
Very good, very good. Lack of resources, limited resources. Excellent. Anyone else?
Someone replied through work-life
Yeah, please,
balance.
please. Work-life balance.
Yes.
Okay. So it is very difficult to balance it, right? That is what they meant, I feel. Then, if any message, please let me know, because I can't see the message. Okay, I just put up some points. So first point, as you mentioned, workload. So there is high turnover among nurses nowadays across the globe, not only in Kerala, Karnataka, India, right? Across the globe, even the nurses from UK are moving to Australia. Nurses from UK are moving to Canada. Okay, so nurses from Canada are moving to America. So there is a lot of turnover among the nurses. Because of that, high work pressure among the nurses. assignments in non-trained roles. So I am a psychiatric nurse. If I am posted in a cardiac ICU, I may find some time to adjust to that particular situation. So present generation doesn't want to take those kind of responsibility. Perceived inadequacy of skill and training. Okay, this was happened during COVID-19 pandemic, right? Even we call some of the students COVID batch because they are half trained nurses or doctors. Okay, whatever you say, they lack the skills during that time, but I am sure that they cope up with that after the COVID-19 pandemic. Risk of getting infection, this also started after COVID pandemic. So nowadays we can see people wearing masks full time, right? Limited resources, this was mentioned by one of the participants, and also the inadequate facilities. So with that, I am moving to the introduction. Building resilience is recommended as a key preventive strategy against burnout among health professionals. So it is globally recognized that nurses, midwives, and health workers are often the first and only point of care in their communities and therefore play a vital role in providing health services. However, the world faces a severe deficit of these critical caregivers with a projected shortage of 18 million health workers by 2030. So by 2030, we have a huge shortage of health workers and nurses. So below target staffing is associated with a 2% to 15% increase in mortality. So when we have less staff, that leads to 2% to 15% mortality. While an increase in 1 nurse per 1,000 inpatient days is associated with a 4.3% decrease in mortality. So if you can maintain the nurse-patient relationship, nurse-patient ratio, that will help you to improve, decrease the mortality rate. The strategy is to close the workforce gaps, therefore in high demand. So interesting statistics. While lower recruitment numbers are a contributing factor, the retention of existing nurses is a global concern. From high turnover rates reported in the USA, that is 16.5%, to 20% of nurses in Kenya reporting they would leave the profession in 2 years, to a 7.5% reduction in job satisfaction reported in Germany. So I have explained almost all the regions, geographical locations. USA, you can see there is problem. Kenya, you can see there is problem. And European country, Germany, you can see there are problem. Around the world, nursing is considered to be one of the most stressful profession, given the demanding nature of patient care and the complex health system landscape in which nurses operate. Okay, the stress may be because of multiple reasons. As you said, workload may be the one reason, nurse-patient ratio, or the workplace harassment, workplace bullying, workplace discrimination, then economic benefits, right? There are many reasons for the stress. So this is reflected across the globe, with nurses reporting high levels of emotional exhaustion and fatigue, and a subsequent impact on nurses' health and well-being. So left unaddressed, these heightened levels of stress can lead to post-traumatic stress disorder, anxiety, depression, burnout, psychosomatic disorders, alcohol use disorders, drug abuse, workplace injury, and musculoskeletal disorders. So when we talk about stress, I think the next session is more about stress. Jason will be explaining that we have two kind of stress, use stress and distress. Use stress is required to work better in the hospital. But when we have distress, definitely we have to manage it. If you are ignoring the distress, that may leads to mental problems. So these effects have implications for productivity and importance. When nurses' well-being is impacted, patients suffer as well. If not addressed appropriately, high levels of stress can lead to tardiness. Okay, whatever you do very slowly, high turnover, and nurses distancing themselves emotionally and cognitively from their work, which can result in suboptimal patient care. So ultimately, it will affect the individual nurse, organization, and the patient. So we will move on to another terminology called burnout. So what is burnout? So burnout is a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. All are having stress. We cannot avoid stress. We can't escape from the stress, but how you manage stress makes a difference. Okay. So if you cannot manage chronic stress, that leads to a syndrome called burnout syndrome. 3 dimensions of burnout identified by World Health Organization. When we talk about burnout, there are 3 dimensions. The first one is feelings of energy depletion or exhaustion. So when you have this kind of symptom, it will affect our physical health, it will affect our mental or psychological health, and also it will affect our performance. Okay, so that is known as feelings of energy depletion and exhaustion. For example, it may affect your sleep, it may affect your eating pattern, it may affect your physical activity, it may affect the way you're working in the ward. Second one is increased mental distance from one's job, or feelings of negativism or cynicism related to one's job. That means you are not interested to go for job, you are taking long leave, if you're going to the ward, you cannot concentrate in that way. Reduced professional efficiency. So whatever you do, there is slowness, there is inefficiency, you are pricking the patient n times to get the vein. So these are the symptoms of reduced professional efficiency. So these are the 3 dimensions of burnout identified by the World Health Organization. The first point is feeling of energy depletion or exhaustion. Second point is increased mental distance from one's job. The third point is reduced professional efficiency. So next question to you, what is the impact of burnout among nurses? Can you think of this point? So what are some of the impact of burnout among nurses?
So work productivity will be decreased.
Very good. Work productivity will be decreased work productivity. Anyone else?
Unable to meet the patient requirement.
Very good. Unable to meet the patient's requirements.
And also unable to meet the organizational objectives. So
Unable to
whatever it
meet
will
the
be training
organizational
hospital
objectives.
or it
Very
will
good.
be
Very good.
educational.
Yes. Anyone else? Unable to meet the, that is an
Also it
important
affects the
point.
family
Yes.
life also.
The family life also. So I was clicked about your second point, unable to meet the patient requirement. Suppose imagine that you are working in a government hospital, 100-bed hospital. Okay, 100 beds may not be there, but most of the time 100 patients will be there. Bed strength will be 50 or 60. You start giving injection by 7:30 or 8 a.m. You're supposed to finish it by 10 o'clock. But if you cannot finish by 1:30 also, then we will be suffering, right? Excellent point. Anything else? Anyone else?
I encourage all the participants to join to that conversation.
Yes. Okay, so this time I'll put up the slide. So it may lead to emotional exhaustion. So I already told what is emotional exhaustion. It may affect our physical health. It may affect our mental well-being, like maybe stress, depression, sleep disturbance, and also it will affect our performance level. And another important point is the depersonalization. Sometimes we feel that we are a different person. That is known as depersonalization. And also reduced personal accomplishment. Okay, you're supposed to attend today's webinar. You are not supposed to. You're supposed to complete an online course. You are not supposed to. You are supposed to join for a conference. You are not supposed to. Right? So ultimately, it will affect your work performance. Ultimately, it will affect your promotional opportunity, professional development in that way. So this is something serious because we are talking about burnout, not the normal stress. So when we call burnout, that will have severe impact on us. That is why I put it as emotional exhaustion, depersonalization, and reduced personal accomplishment. So I thought this particular terminology also important when we are talking about burnout, emotional labor. Okay, so I could say most of the time our emotions are according to the need of the organization, right? Sometimes we wanted to cry, we cannot. We wanted to laugh, we cannot. We wanted to scold some person, cannot, right? So that is known as emotional labor. It is a process of regulating both feelings and expressions toward organizational goals. So finally, I came to the terminology resilience. Can anyone tell what is resilience? According to you, what is resilience?
Resilience is the ability to cope after
Okay.
facing a stressful situation.
Yes, very good. How we move after facing a stressful situation or difficult situation. Any other viewpoint?
Bouncing from the difficult times.
I can't hear completely. Difficult time. I
Sir,
heard.
it's an ability to bounce back to the normal.
Very good. It is our ability to bounce back to the normal. Anyone else?
Ability to survive in most stressful environment or the situations where the hopes are very minor.
Very good. Abilities to survive in most difficult situations. That is what I understood. Okay. Most stressful situations. Anything else? Any other point? Okay, I just put up a definition. The acquired ability to reframe stressful events and to recover, adapt, and grow from stress. So we cannot avoid the stress. How we grow from stress, that is exactly the resilience. So I put up one more definition given by American Psychological Association. The process and outcome of successfully adapting to difficult or challenging life experiences, right? So the process and outcome of successfully adapting to difficult or challenging experiences, especially through mental, emotional, and behavioral flexibility and adjustment to external and internal demands. So according to this definition, we have difficulties, we have challenges, but how we overcome those challenges. Okay, we have to have some modifications in our mental ability, emotional well-being, and behavior. Okay, and also we have to adjust to the internal and external environment or to the demands. So my next question, why building resilience is important for nurses? Tell me, why building resilience is important for nurses? Do you think it is the individual responsibility? Do you think it is the organizational responsibility? Do you think it is the family responsibility? Do you think it is the responsibility of the community or the society? So what is your thought?
Because the well-being of the patient is completely in a nurse's hand
Okay,
at the hospital.
okay. So
So it
resilience
is very
building is,
important for
yes,
a nurse to have a resilience. She cannot bring any of her personal emotional status into a consideration while dealing with the patient. She has to be completely follow the ethics where she
okay,
has to only focus on coping of the patient rather
okay,
than any of the turmoils.
okay, very good, madam. So ultimately it will improve the patient outcome. Am I right?
Yes, sir.
Yeah, thank you. Any other viewpoint? Any other viewpoint? I think there are many important points. I just project only 2 points. prevent burnout. So why preventing burnout is important? So when there is burnout among nurses, ultimately it will affect the health of the nurse and also the patient outcome. So preventing burnout is very, very important. So the resilience building will definitely helps to prevent burnout. Burnout is nothing but the job related stress, chronic stress, which arises from job stress, arises from the job situation. Okay. Second point I wanted to project here is for the organization, how it will means affect the organization. It will improve the retention of existing nurses in a hospital. Okay. So when you talk more about resilience in a particular organization, if it is in the hospital or college of nursing, it will improve the retention of existing staffs in that particular organization. So here I have certain myths and facts. I request the participants to comment on this. So here is the first question. Resilience is an inborn trait. Is it a myth or a fact? I request one by one to answer it. Resilience is an inborn trait. What is your opinion? Is it a myth or a fact?
Sir, it can be, it cannot be. Resilience can be built at any point of life,
Okay.
depending on the coping strategies.
Okay. You said it can be, cannot be. So literature says it is a myth. It is not a fact. Okay. Resilient people don't experience emotional pain. What is your opinion? Resilient people.
They do, sir, they do experience, but because they are resilient, they will handle it with the positive coping defense mechanism.
Okay, so you cannot clearly say that it's a myth or a fact.
Sir, definitely it is a fact, sir. I don't think it is a myth, according to.
Okay, resilient people, it is negatively stated. Resilient people don't experience emotional pain. So is it a fact or a myth? So it will be a myth, right? Resilient people experience emotional pain, right? That is what you want to say, right? Yes. Okay.
Yes, sir.
Yeah. Thank you. I got the point. Third one, resilience means recovering instantly from adversity. What is your opinion?
Not instantly, sir. They do take time.
Okay, definitely it will be a myth. Resilience can be developed on one's own without assistance.
Of course, with the assistance most of the time.
Thank you. So this will be a myth. Resilience is solely an individual quality.
Very true, sir. It is an individual quality.
Okay, but again, there is conflict between this statement. Some people say it is a myth. Some people, as you said, say it is a fact. Resilience guarantees unwavering success.
Very true, sir.
Yeah, so certain extent it is true, but there are people say that it is a myth also. All coping strategies are equally effective in building resilience.
So can you repeat the question?
All coping strategies are equally effective in building resilience.
It's a myth, sir.
It is a myth. Resilience is only relevant during times of crisis. Resilience is only relevant during times of crisis. What is your opinion?
It's a myth.
It's a myth. Very good. I can't read this because your message is hiding. Can anyone tell this? Yeah, sorry. Resilience replaces the need for professional mental health support. What is your opinion? I think I can hide this, right? Yes. Resilience replaces the need for professional mental health support.
No, they need.
No, because resilience is only one component of professional mental health support. It cannot replace the professional mental health support. So it is a myth. There are some more questions. I request all of you to answer quickly. People are much more resilient under adverse conditions than they might have expected. What is your opinion?
Sometimes.
Yes, it is a fact. A person may be resilient in some situations and with some types of stresses, but not with other stresses?
Can be, sir.
Yes, it is a fact. Mindfulness breathing promotes calmness and resilience. I will give the answer. It is a fact. Creating a new routine is very helpful for feeling normal and fosters resilience. It is a fact. Exercise of any kind will boost your immune system and promote resilience. It is a fact. So I just wanted to put your thoughts about the myths and facts about resilient behavior. So next question, what are the factors influencing resilience among nurses? Can anyone contribute? What are the factors influencing resilience among nurses?
Their communication skill among the nurses, their
Yes.
relationship with the co-workers,
Yes.
and
Anything
if they
else?
like the place where they work,
Okay.
better results.
Okay. Any other thoughts? Okay, so there are certain personal factors like the mindset and coping strategies used by the nurses. Okay, so you know there are two types of coping mechanism: adaptive coping mechanism and maladaptive coping mechanism. So we always recommend to use adaptive coping mechanism, which helps to improve our resilience behavior, self-awareness and emotional intelligence, how you are controlling your emotions while interacting with the patients. Most of the time, nurse-patient interaction and the violence happens because of the communication. The mistake either happened from the nurse's side or from the patient side. Health and well-being is important, and also the personal values and beliefs. So personal factors definitely influence resilience behavior. And of course, the organizational factors, we cannot ignore it, right? The work environment, leadership and management, workload and resources, the support you get from your higher authority, how cooperative your ward in charge is, job control and the autonomy, the freedom you are getting in the work environment. Okay, so third important factors, the external factors, maybe the social support you get, community support and social factors you have, and economic and political climate. So these are the three important factors influencing resilience among nurses. So I just put this slide to make you understand that only the personal factors cannot build resilience. Okay, resilience building happens with personal factors, organizational factors, and the external factors. So I'm sure that many nursing students are sitting there. Could you please tell me this? Could you please comment on this? I want the students to comment, not the faculty or nurses. What are the factors influencing resilience among nursing students? Students, please. That means no students are attending today, Atulya?
Yes, sir, they are attending.
Okay.
Students, I am encouraging you to reply.
Please.
Students, there is no right and wrong. You can give the answer.
Yes, you are right always. Nothing
Yes,
wrong.
you are right. Devaki Jasmine replied attitude towards nursing.
Very good. Anything else?
Then Satya replied to overcome tough situation.
Overcome tough situations. Okay.
Yeah.
Very good. Excellent point. Some more points, please.
Yes, students, come on.
How well the student is prepared to face wherever they are posted.
Okay. Their preparation to work in a particular unit, right? Excellent. Then any other point? So here also the points, almost similar points, personal factors like the copying skills are very important for the students. The present, you can look into the present syllabus of BSc Nursing, semester syllabus. It is a very tough syllabus, I could say, right? So the students are busy, almost 24 hours they are working to complete the assignments in our institution. And it is very difficult for a below average student to cope up this with the academic stress. Self-efficacy is important. Confidence is important. Motivation and commitment is important. And also, of course, the emotional intelligence. Sometimes they fight each other, they scold the teachers, right? Physical and mental health is also important. There are a lot of issues related to mental health among the children nowadays after the COVID-19 pandemic. And educational factors, you forgot about this educational factors, curriculum and program support, right? Our syllabus is prepared by the Indian Nursing Council, though prepared by the Indian Nursing Council, it is implemented by the individual college, right? So how well it is implemented, clinical experience and mentorship you are getting from the teachers, and the feedback you are getting from the teachers, how you are evaluated by the teachers, peer support you get from your peers, and also the collaborative activities. Of course, the environmental factors like supportive learning environment, then institutional resources, right? Are you getting adequate notes? Do you have a library to go and read? So then the lab facilities all makes a difference, right? And initially someone told about work-life balance. So these are some of the points related to the factors influencing resilience among nursing students. Here also, please understand that only personal factors will not build the resilience. We need educational factors and also the environmental factors. So when we talk about resilience building, there are 3 levels of change. Okay. So first one is modifying the organizational structure and work process. Okay. So I cannot comment on that because it depends on the organizational policy based on the number of patients, nurse-patient ratio. So many things decides the organizational structure and work process. So I could say one example of integrated practice or the dual role. Okay, most of the aims, maybe Jason can explain very well about that. Most of the aims follows dual roles. That means faculty of College of Nursing are involved in hospital related activity also. So they are not working as nursing officers. Maybe they are involved more in student supervision, and they have the role of nursing superintendent or assistant nursing superintendent or the ward in charge in that way. Okay. So second point is improving the fit between the organization and the individual health worker through professional development programs and interpersonal programs. I wanted to quote here that professional development is not an individual responsibility of the nurse. It is the combined responsibility of organization and the individual nurse. And the individual level also certain actions are required to increase resilience and promote effective coping and healthy behavior. So these are the 3 levels of change required to build resilience. So next question to you, what are the benefits of increased resilience among nurses? Students, can you list out some of the benefits of increased resilience among nurses?
Students, you can write it in the chat box as well.
Yeah, please.
Diksha Arora replied, increase competency.
Decreased competency. Okay, very good. So decreased competency, maybe she's confused. What are the benefits of increased resilience?
Work more efficiently.
Okay, work more efficiently. Okay. Then anything else?
Quality patient care.
Okay, quality patient care. Any other point?
Students, any other points? You can write it in the chat box. We are reading here.
Okay, so I just put up some points. It will improve the well-being of the nurses and nursing students. Then life satisfaction. It will improve the patient satisfaction. It will improve the quality of care and better attitude towards patients. Then it will improve the psychological health of nurses and nursing students. Improved work relationships, improved professional quality of life, and also increased job satisfaction. I think the students have contributed to some of these points.
Yes, they contributed one more point. Reduce patient mortality rate.
Very good, very good, very good point. To build resilience among nurses by American Nurses Association. So these are the steps identified by the American Nurses Association. I think this steps was identified during the COVID-19 pandemic, but still it is applicable to the current scenario. That is the reason I just put up this. Recognize if you are feeling stress and take steps to manage it. Acknowledge that what you feel is normal. So that is the first step they identified, recognizing the stress. Second step identified by American Nurses Association is practice self-care. So they give a lot of importance to self-care to build resilience. And the third factor they identified is cultivate kindness and recognition. So these are the three steps identified by the American Nurses Association to build resilience among nurses. If you analyze one by one, recognizing the stress. So they say, find someone trusted you can talk to. So when we talk to someone, that definitely help us to ventilate our feelings, right? Improve our mental health. Limit your exposure to news and social medias. I think this is a point which is applicable during that COVID-19 pandemic. Verbalize what you need and accept help from others. Okay, something which you cannot do, we have to ask help and get it done. Find additional tips to manage stress. So this is what they comment on stress. That is the first point. Second point, they talk about practice self-care. Ensure you get breaks. So sometimes we are working 8 to 12 hours in a ward, right? So we need short break, right? Keep nutritious snacks on hand, especially when you're working in the ward. Maintain a good sleep hygiene. That is most important for the nurses. Keep a journal. Okay, so I'm not sure how many of you are writing diary, and maybe what we can do every day, we can reflect on our activity, right? Every day evening when we go, just 1 or 2 minutes, we can think of what are the mistakes I have done today, what are the good things I have done today, how I can improve for tomorrow. Okay, that is nothing but keeping a journal. Find additional self-care information. So these are the points they mention about practicing self-care. So when we talk about self-care, you have to remember 3 important points. First one is exercise. Second one is eating. Third one is sleep hygiene. So this is most important. So the third step they said is cultivate kindness and recognition. Okay, so what they mean by this particular point is help someone every day. Okay, the moral of this point is help someone every day. Perform one random act of kindness a day. The feeling you get knowing you have made someone's day will help to energize you. And even if you are not expecting it, you are bound to get it back in return when you create a culture of kindness and recognition. Definitely, as nurses, we are helping many patients. Nursing students can think of helping other students, those who are academically weak. So cultivate kindness and recognition. So ANA always talk about anything based on the evidence. So this is an evidence-based point they are telling, cultivate kindness and recognition. So when we talk about resilience, there are different resources to manage resilience. I just listed out some of the resources, individual resources we have. For example, psychological resources like positive temperament or robust neurobiology, social like responsiveness to others, pro-social attitude, attachment to others, intelligence related, academic achievement, planning and decision making, communication skills, developed language, advanced reading, personal attributes like tolerance for negative effect, self-efficacy and esteem, internal locus of control, self-humor, sense of humor, hopefulness, strategies to deal with stress, enduring set of values, balanced perspective on experience, malleability and flexibility, our ability to control. Then we have family related factors like supportive families, parental warmth, encouragement and assistance, cohesion and care within the family, close relationship with a caring adult, belief in the child, non-blaming, marital support, talent or hobby valued by others, socioeconomic status like material resources we have, and also community related factors, school experiences like supportive peers, positive teacher influences, success, academic or other. That is more applicable to the nursing students. That's the reason I put up here. Supportive communities, belief in the individual, non-punitive attitude. Of course, the cultural resources like traditional activities, traditional spirituality, traditional languages, traditional healing. All these factors are contributing towards resilience building. So I'm going to explain how to apply evidence-based practice to develop, implement, and evaluate resilience building strategies. Okay, this is just an example I'm going to put up. Okay, this is I got an opportunity to contribute towards a resilience toolkit. So I got some points from that particular experience, and I made a strategy here. So this is the strategy. This can be utilized for teaching resilience among the nurses or nursing students. The first point is explore the problem. Okay, understand the terms. Okay, Then understand health worker needs. Second point, they are talking explore the evidence. Okay, review key behaviors, review key determinants, review what works and what doesn't work, review gaps in the evidence. And after that, apply the evidence. Review the resilience frameworks. We have to develop a resilience framework based on the evidence we created. Create a strategy map. Co-create and iterate. That means involve multiple stakeholders and end users to co-create. Conduct user testing. The short of that is, once the strategy, the framework is developed, we have to test it, right? Pre-testing or pilot study to be done. Then we have to implement it. After implementation, evaluation. Complete measurement plan and conduct real world testing. So these are the steps which I have identified to apply evidence-based nursing practice to develop, implement, and evaluate resilience building strategies. Quickly, we can go through these points. Explore the problem. When we talk about problems, there are modifiable problems and non-modifiable problems. I mean to say, certain problems can be modified by the individual, certain problems cannot be modified by the individual. I put some examples here. Having the energy to do the things one wants to do, the vitality, right? So that can be modifiable. Having a sense of purpose and meaning in life can be modifiable. Having strong personal relationship can be modifiable. Being accepted by and belonging to groups can be modifiable. Being able to manage emotional state, positive or negative emotions, can be modifiable. Having the ability to bounce back after adversity is modifiable. Experiencing mastery is modifiable factor. Expressing creativity, having new experiences, all are considered as modifiable by the individual. There are certain factors difficult to modify by individual. You can think of other examples also. Okay, socioeconomic status. Well, sometimes it is difficult to modify by the individual, right? Our income level, social status relative to wealth or power, right? Safety or security. Sometimes it may not be in our hand, including financial or physical. Political climate or cultural norms, sometimes not in our hand, right? Individual factors like our age or gender or personality, we can't modify those factors. Okay, so explore the problem. That is the first step in evidence-based practice when we talk about resilience building. So 5 levels of influence on health behaviors and health outcomes. That means when we talk about burnout, there are 5 levels of influence on health behaviors and health outcomes. First one is individual. Okay, our attitude, our beliefs, our knowledge, our self-efficacy, our skills and behaviors have an influence on our behavior, especially on burnout. Interpersonal relationship. Okay, close social networks and support systems such as friends and family definitely have an influence on health behaviors of a person. Third one is organizational factors. Organizations and institutions have an influence on our behavior. Community factors like where an individual lives, works, and broader social connections have an influence on health and behavior. Public policy. Okay, so for example, local policy, state policy, and national laws and policies. Okay, suppose you are working in a hospital and there is no policy on workplace harassment. Okay, so when you have an harassment, no action will be taken because there is no policy related to that. So policy plays an important role in determining our stress or burnout or resilience, whatever. So these are the 5 levels of influence on health and behaviors, health behaviors and health outcomes. So second step is explore the evidence. Okay, first step we identified is explore the problem, and second one is explore the evidence. Okay, so we all studied about the evidence levels, right? Can anyone tell what is the highest and lowest level of evidence pyramid? So what is the highest level and lowest level of evidence pyramid?
Systemic reviews and RCTs are highest level of evidence.
Okay, very good. Lowest?
Lowest, I think, original articles.
Pardon me?
So maybe individual articles.
Individual article. Okay. So the highest level, you are right, maybe the systematic review and meta-analysis. When we talk about nurses, we move up to that level, right? Systematic review and meta-analysis is considered as the highest level of evidence. The lowest level, maybe we can consider the expert opinions, right? Sometimes if you have a doubt, nursing students having doubt, they will go and ask with the teachers, right? That is an expert opinion. So that is the lowest level of evidence. Okay. So when we explore the evidence, we have review resilience building. We have different evidence, right? We have different sources to explore, right? You can do a systematic review. If you are not expert in systematic review, you can go for a scoping review. If you don't know scoping review, you can go for a narrative review. If you cannot do that, just do a review. We call it as review of literature, right? So we can talk to the experts, right? So there are different way of getting the evidence. So review resilience building behaviors. Okay. So these are some of the evidence-based strategies I have put up: stress management, mindfulness and relaxation, self-care, connecting with others, connecting to purpose, seeking growth. Okay. So for example, can I ask you one question? Spirituality. So spirituality moves to which point under this? Can anyone comment? Spirituality moves to stress management or mindfulness, self-care, connecting with others, connecting to purpose, or seeking growth. So spirituality fits into which point? I just want your thought. That's all.
So mindfulness.
Okay, mindfulness, we can connect with mindfulness. Any other point? Anyone else? So also we can connecting to purpose. Okay, it also fit into connecting to purpose. Okay, I will ask you one more question. Mentoring and supervision. This is for the nursing students. Mentoring and supervision moves to which point? Mentoring and supervision. Can anyone?
Connecting with others.
Very good. Seeking growth, connecting growth. So once we have resilience building behaviors, we have to identify the key determinants. Okay. So these behaviors will help for coping and control. We'll get a sense of purpose. We will be more hopeful, more meaningful. We will be more optimistic, right? Human connections, like we will have more support, right? Interpersonal relationship, so in that way. Then we have to review what works very well. For example, the holistic programs, stress management training, team work training, social interactions, rewards and recognition, psychoeducation, mentorship and leadership, spiritual support, workplace policies. So this slide is all about the resilience building among nurses. Okay. You can see what are the strategies works very well. These are based on the evidence. So after exploring the evidence, it is important to explore the evidence gaps. So when we do the systematic review, we will identify the gap. When we identify the gap, we have to search for the gap, right? Evidence generation is required again when we identify the gap. Okay. So after identifying the evidence, apply the evidence. Okay. So we can think of developing a resilience framework. Okay. Once we have the review, we have the article, we have the evidence, we found out what is working and what is not working, then we can go for developing a resilience framework. So I just put an example of a resilience framework. This is a framework called a dynamic framework of resilience developed by McAllister and Breen in 2013. So he has identified this framework based on certain factors. For the first factor he identified is the workplace factors. Okay, he has listed out certain factors like client stressors, team stressors, environment, resources. Okay, all these factors are important. Then he has explained the contextual factors. Certain situations, certain factors are important. That is known as contextual factors, risk factors. Every time it will not come, right? Certain situations we will have the risk factors. Then protective factors we have, right? Suppose suppose in nursing care you did something negligence, you may not have a protective factor when you do some mistakes, right? Our spiritual assets all will determine our internal resiliency. And finally, if everything okay, that positive, he called it as adaptation. If it is maladaptive, low level of resilience. If it is positive, high level of resilience. So this is one example of a resilience framework. Maybe we can think of developing this kind of framework which is applicable to our setting. So the fourth step in EBP, which I have mentioned earlier, was co-create and iterate, that translate the evidence-based approach to the local real-world settings. That means we have developed a framework, we have tested it. After testing it, we have to implement it. The selection of a particular delivery mode may be related to an individual's preferences, availability, or their ability to access the intervention. Suppose you are developing a resilience building training program for the nurses of India. So if you make it online, many of the nurses will not attend. If you make it on-site, majority of the nurses will not attend. So what is the solution for that? Maybe we can think of a separate online module, a separate offline module, and also we can think of digital copies and the hard books, okay, so that it will reach to every nurse. So we have to think of how to implement it effectively. So after implementing, outcome evaluation. So here we have to, there are different levels of evaluating: exposure to the intervention to be evaluated, then key determinants to be evaluated, key behaviors to be evaluated, and also the individual outcomes to be evaluated. So when we, and one more is organizational outcomes. So some points, some examples I put up. Copying and control. Okay, so we have to evaluate the copying and control. It is one of the key determinant, right? So we can evaluate the coping skills, problem solving skills, confidence of the nurse, mindfulness, ability, self-compassion of the nurse, work-life balance. So we can use different tools to evaluate this. These are the points or the variables which we can evaluate. So another point is sense of purpose. Okay, the previous slide also I talked about sense of purpose. So how to evaluate it? So there are different dimensions. Sense of coherence can be evaluated. Optimism can be evaluated. Hope can be evaluated. Feeling valued can be evaluated. Then the human connection. We can evaluate the emotional intelligence of the person, teamwork of the person, communication skill of particular nurse, perceived social support of the nurse, and perceived institutional support. And also the individual outcomes like perceived stress can be evaluated, resilience behavior can be evaluated, well-being can be evaluated, psychological distress can be evaluated, burnout can be evaluated, and also the work productivity. So I just put up this previous slide again to sum up this. So first step is explore the problem. So understand what are the modifiable and non-modifiable factors. Then explore the evidence. We can go for a systematic review or scoping review or narrative review or any other kind of research to find out the research gap. So after identifying the research gap, you can think of developing a resilience framework. Okay, apply the evidence. After developing, we have to test it, co-create and iterate. So when we are testing, we need to take the opinion of the stakeholders, right? We have to do a pre-testing or pilot study. Then we can think of how to implement to the target population. And finally, we have to evaluate the model. So finally, to sum up, I just put up resilient building strategies for the nurses. Can you quickly tell 2-3 points how to build resilience among nurses? Now we have to come up with some strategies, right? Can anyone comment? Resilient building strategies for the nurses. Anyone? I think I have mentioned in the previous slides. The only thing you have to just list out 1 or 2. Anyone?
Nurses should have a sense of humor.
Yeah, very good. Sense of humor.
Then self-care.
Self-care.
Good diet, sleep, exercise. Then
Very
journaling.
Good. Very good. Very good.
Then ask for help.
Very good.
And talk to someone you trust.
Very good. Excellent.
And find additional tips or information.
Find additional tips or information. Excellent point.
And healthy communication.
Healthy communication. Very good. So I will not ask because we are running short of time. So whatever the madam said, it will definitely fit into any one of this component. We have personal strategies, organizational strategies, and community and cultural strategies. Personal strategies like self-care. She was speaking about self-care, stress management, reflective practice. She was talking about journaling and all. Positive relationships, professional development. These all moves to the personal strategies. Then organization also play an equal role in building resilience among nurses, like supportive leadership, work-life balance, recognizing and rewarding hard work, safe work environment, and access to resources. And of course, certain community and cultural strategies. I could say our Nurses Association play an important role in this factor, community and culture strategies, right? We have TNAI, most of us are member of Trainers Association. So promote a positive work culture, community engagement, and cultural competence. So when we talk about resilience, when Principal Madam called me, she told you have to discuss about the some of the tools, mental health tools. Maybe she meant this resilience assessment. We use different tools. Corner Davidson scale is a well-known tool. Brief resilience scale is another well-known tool. Resilience scale for nurses available. Resilience scales validated in Nigeria is available. Resilience at work scale is also available. There are many scales. I just listed out which is more applicable to the nurses. So I have an exercise for you. So are you ready to bounce back from your stress? So I just put one particular tool. This is the brief resilience scale. I request all of you to fill this. This is an activity for you. I humbly request all of you to score it. Okay. The minimum score will be 5 and maximum score will be 30. You don't, I will not ask the total score now. Just you do it. Okay. This is for your introspection. I will not ask the score. I promise you that I will not ask the score, just to introspect yourself and find out where you are standing in terms of resilience. All are here? Are you able to see this?
Yes, yes,
Yeah,
sir.
yeah. I'll just read out. So scoring is a little tricky. Okay, reverse scoring also there. So accordingly, you can score it. The first item is I tend to bounce back quickly after hard times. So 1, 2, 3, 4, 5. Strongly disagree 1 and strongly agree 5. Second question, I have a hard time making it through stressful events. 5 to 1 is the scoring. Third one, it does not take me long to recover from a stressful event. 1 to 5 is the scoring. It is hard for me to snap back when something bad happens. Some people, it is easy to come back. Some people will take long time to come back, right? So 5 to 1 scoring. I usually come through difficult times with little trouble. Okay, 1 to 5. I tend to take a long time to get over setbacks in my life. 5 to 1. So I will pause for 1 minute. If 1 or 2 finish, just tell me yes, so that I can move to the next slide. So this is a tool developed by Smith et al. I'm not sure it is copyrighted tool or not. So by citing the reference, I just put it here. This is used only for the academic purpose, nothing else. All of you finished? This 1 or 2?
I hope everyone is finished already.
Sure, na?
Yeah.
Students, can you put my message once you finished? Yes, no, something like that. Done. Done now?
Students, did you done your scoring? You can write in the chat box. Yes, sir.
Okay. So divide the total score, total sum of score by 6 to get a total average score. So you get, suppose you get 30 divided by 6 will be 5, right? So total score divided by 6 will be your total score, means your resilience score. Divide the total sum of scores. Imagine that you got 30, then 30 by 6. 30 by 6 is 5, right? So your score will be 5. All of you got it? And once you get, this is the interpretation. Okay, so I'm not asking the score. You can just see which level you are there now. So you get a total score. Imagine that you get a score of 30. There is an error here. It is not mean. Okay, mean score will be 5. 30 divided by 6 will be 5. 29 divided by 6 will be 4.83. So if you get a score of 5, you have very high resilience. Imagine that your total score is 6. 6 divided by 6 is 1. That means you have a very low level of resilience. So this is known as brief resilience scale. All of you got it? Is it done?
ಬಂತು ಮಾಡಿದೆ.
Can I move to the next slide? Okay. So building resilience among nursing students. So, so building among nursing students here also education on resilience. Okay. I don't think that resilience building is part of our UG curriculum. Maybe we can think of adding a value-added course or open elective course on resilience building for the nursing students. Mindfulness and self-care, right? So maybe we have to emphasize on mindfulness and self-care to the students. Peer support networks. Definitely students require peer support networks. Maybe the Student Nurses Association can take an active role. Someone is talking. Can you please unmute?
Excuse me,
Sorry,
sir.
mute. Yeah.
Excuse me.
Yeah.
Babida Ravish, can you please unmute your mic? Unmute your mic. Mute your mic. Tabitha Radesh, please
hear
mute
that.
your mic. And Jain Prakash as well, please mute your mic. Okay, sir, you can continue.
Okay. So peer support networks, I wanted to say that SNA play an important role in that. Then professional role models. Okay, so the teachers are the role models, so the teachers can show the role models to the students. And the reflective practice. So I request the students every day evening, you go back to the room and reflect on the positive and negative aspect of that particular day, how to improve the next day. And also mentoring. So nowadays the teacher guardians play an important role in building resilience among nursing students. So these are the points I would like to emphasize for the nursing students: education on resilience, mindfulness and self-care, peer support networks, professional role models, reflective practice, and mentoring. And finally, I would like to say the 4 A's to nurses to avoid stress. Okay, to change the situation, try to avoid the stressor. I'm not telling every time it is possible. If you cannot, alter the stressor. Okay, then change your reaction. Okay, I try to adapt to the stressor. If you cannot, accept the stressor. So these are the 4 A's tips to the nurses to avoid stress: avoid the stressor, or alter the stressor, or adapt to the stressor, or accept the stressor. So nowadays we talk more about research. So resilience building also, there are a lot of scope on research. You can think of development of a home health intervention or digital intervention for resilience building for the nurses. Effectiveness of resilience building programs you can think of. Impact of organizational support and nurses resilience you can think of. Resilience and patient care outcomes you can think of. Personal characteristics and resilience you can study. Cultural difference in resilience. Role of peer support in building resilience. Technology and resilience. Resilience in different nursing specialties. Impact of work-life balance on resilience. Resilience in response to crisis situation. Gender difference in resilience. Resilience and burnout prevention. Long-term effects of resilience interventions, integration of resilience training in nursing education. There are many scope for the research. For those who are doing MSc nursing or PhD can think of this kind of topics, because the resilience building is not very active among the nurses in India. So if you want to improve your knowledge, I can recommend certain online courses offered by the Coursera online platform. Coursera is an online platform. I'm sure that you are aware about this. There is a course called Mental Health and Resilience for Health Workers by Toronto University. Then Positive Psychology, Resilience Skills by Penn University. Then Resilience for Everyone specialization. Okay, so these are some of the online courses available if you want to improve the knowledge on resilience building, especially related to the nurses. So to conclude, nurturing resilience in nursing is essential for fostering a supporting and effective healthcare environment. By integrating resilience building strategies into education practice, nurses can better navigate challenges and provide high quality care. Remember, resilience is about learning to thrive despite adversity, ensuring both personal well-being and professional excellence. So these are my references. So open to you for any questions or any suggestions or to add any points.
We are incredibly grateful for the valuable knowledge you have shared with us, sir. Now, the session is open for the discussion. Those who have a question can mute the mic or raise the and can unmute the mic or raise the hand and ask a doubt. Put your doubts on the chat box. You can unmute your mic and ask questions. Or you can just put your questions in the chat box. We will read here.
Next session at 11:30, madam?
Yes, Level.
Okay. On time. I think I have exceeded 10 minutes. We started a little early.
Participants, this is the question and answer time.
There are no questions, then we can wind up, ma'am. Maybe Jason will be waiting. You can put up in the chat box at any time. I can address.
Someone commented informative and practical tips.
Thank you.
Then another person wrote like a very informative session. Tabitha Ravish, can you please mute your mic? Is there anyone have any question? Do we need to wait for you? Sir, instead of question, there are so many messages like informative session, well explained. Thank you. Thanks for the valuable session. So I think we can wind up.
Thank you, madam.
Okay, thank you, sir.
Thank you.
Diba Mariam, sir, 1 minute. Diba Mariam, do you have any question?
Sir.
Satya asked a good, informative, and useful session. How we can apply it in profession?
So that's what I said. It is a combined responsibility. Individual nurses cannot build the resilience. We need support from the organization. Also, we need support from the community. So it is a combined effect to build resilience. But of course, whatever our role we should do, especially the self-care. Okay. Nowadays, we are ignoring in that part. So when you start working, especially in the clinical, we forget about eating, sleeping, physical activity, right? We don't want to do the blood testing, right?
Yes. Okay. Okay. Thank you, sir. We will wind up our session. Thank you for your valuable time.
Thank you, ma'am. Thank you. Bye.
Okay. Thank you. Ladies and gentlemen, esteemed participants, it is with great pleasure that I introduce our next speaker, Mr. Jason Joseph, Assistant Professor, Department of Mental Health Nursing, AIMS, Telangana. Currently, he is pursuing his PhD in Psychiatric Nursing from INC. He has published about 55 publications and textbook chapter contributor. He has served as a resource person in many national conferences. He is a recipient of national awards. Among them includes Young Faculty Research Award 2023, University of Health Science, Haryana. Best Faculty Research Paper 2021, Nursing Research Society of India. Welcome you, sir.
Yeah, thank you, ma'am. Am I audible to all?
Welcome, sir.
Yeah. Uh, Let me share the slide first. So kindly check the visibility.
Yes, of course. Yes, sir. It's visible.
Should I keep in the slide mode now?
Yeah.
Is it visible for all?
Okay.
Okay. So shall I proceed, ma'am?
Yes, of course. Sir. Continue.
Okay, thank you, ma'am, for this kind opportunity. At the outset, I would like to especially give my humble gratitude to the principal, Dr. Professor George George, madam, and the organizing secretary, Mrs. Atulya Kevi, for giving me an opportunity to have a talk on from stress to strength. I'm sure that the time is already 11:30, and my duty is to wind up within 1 hour. And you are hearing about stress, strength, and resilience from the since the morning, the beginning, right? So I take this opportunity to not to teach you, but to have an open debate, open discussion on how the stress, that is the bitter, better, and in that way, how a person he can be moduled from a so-called stress situation to a so-called strength situations. So we are here when we discuss about the stress and strength, and I take this opportunity to explain in 3 levels, because we have to discuss the stress at the personal level. Second, we have to discuss at the private level, and the third, we have to discuss at the professional level, both the stress and the strength. Before I begin this session, let me ask if anyone would like to comment. We all know about the personal level, how stress affects the personal level. We all know about how the stress affects the professional level, how the stress affects the private level. Anybody could give me an answer for this? I shall be highly grateful. I told you that this is not a, we can say that one-time lecture. So let us have a discussion and please share your views. I can pause for a while. My query, let us think the whole thing in 3 dimensions: personal level, private level, and professional level. So how can we distinguish these 3? If anybody is there, I'm sure in webinar you might be doing many other things, right? But I just request among this 1 hour, half an hour with me, right? So that, yeah, our time will be saved. Anybody would like to comment on this? Most welcome. Yeah, someone? So when we discuss about the,
excuse me, sir.
yeah,
Please
sure,
put
sure.
please put the slide in slide mode. Slide mode.
Yeah, it is already in the slide mode, madam, if I'm
No,
not
sir.
wrong.
No, sir, it's not in slide mode. That's
Yes. What is it?
yes, click it.
Is this,
Okay.
now it is in the slide mode?
No, no, sir.
No. Just click
Okay,
it then.
I'll check it. I'll check it again once again.
Okay.
Is it now?
No, sir. Still not the same. Same like.
What about this? No. Not.
No.
From here, from my end, I have already done the slide mode only. I am not getting what is the. Okay, let me last. Is it now?
Yes, sir, it is.
Okay, fine. So let us move on to this stress and the three levels, right? I'm discussing here three levels: personal level, private level, and the professional level. So the point I would like to highlight here in the sense that when a person, that is the things that we and others know, that we call it as the personal level, right? And the things comes under in
Excuse
the
me, sir.
professional domain. We call it
Excuse
as
me, sir. Sorry for
yeah, sure.
interrupting. Someone is talking. Anushree Ammu, can you please mute your mic? Anushree Ammu, can you please mute your mic? Oh, okay, sir. Continue.
Okay. Yeah. Is in webinar this is much quite common, so
Yes, yes.
it's okay.
It is
I think
getting
some
stressful, sir. Anushree
okay.
Ammu, can you please mute your slide? Mute your mic. Okay. Okay, sir. Continue.
Okay, so yeah, so I'm proceeding with this. So my point is to convey you that we always discuss about the personal level and the professional level. The private level we always forget. The point I would like to highlight it is that the private level means the things that only you can only understand, not your significant primary persons or the maybe your husband, wife, or whatever it may be. The things, certain limitations are there with you that you only understand, that may be a strength, that may be a stress to you. So we have to think all these three dimensions when we discuss about from the journey of from stress to strength. However, I'll be dealing today majorly aspects on the personal level and the professional level. So when we think about the personal perspective, we all know that what makes a person towards stress, I believe only two things, maybe our busy works and unbalanced life. And on the same way, busy life plus the unbalanced works both will make us little bit stress in our day-to-day life. Now, the strength that by definition we always that the ability to adapt, how we adapt, even if we are in unbalanced life or unbalanced works. So that this is well-known definition. I'm not going for a discussion on this. However, I would like to further focus on how from stress to strength the journey at the personal level. So when we think about the personal levels, when we look into as a nurse, the goals, we may say many things. Yeah, I would like to be a well-settled nurse at European countries. I could be a well-settled in any of the aids or any of the state government institutes and in the academic settings. I would like to be a well-known nurse research scholar. Yeah, I could be a nurse clinic specialist or nurse practitioner. So these are the things that we keep us, that we think that yeah, these may guide us towards the strength. However, my query it is that we have to think about the whole before setting the goals. That means we will never feel truly satisfied until we are satisfied by the life. The point I am again and again affirming here, whenever we plan for the personal or the professional level, we have to first see that are we satisfied with the current life. Then only we are supposed to plan for the goals and other things. Now, I have only two questions to answer my query. That means how the so-called the from stress to strength could be taken by asking two questions. Number one question that Benu sir is already addressed to you, which is a resilience question. That is, do you look for creative ways to alter the difficult situations? We always talks about from stress to strength. So there are certain difficult situations. The one who is listening to me, kindly give me 30 minutes. I'm just asking you 30 minutes, right? And only two questions. Question number one. This is not a so-called class ordinary lecture. So take it as a take-home personal message. Do you look for creative ways whenever you encounter difficult situations? Possibly, the one answer could be yes, sir, yeah, madam. I'll sleep 8 hours each night. I'll work for 8 hours per day. I'll enjoy the remaining 8 hours with my family and friends. So that simplify, I will do some time calculations when I face some difficult situations. Can it be say that it is a creative way? And I should say it is not attainable with calculations. I repeat the same question. Do you look for creative ways to alter difficult situations? Now, the answer which I would like to suggest to you is that creativity is something that seeing the same thing as everybody else, but thinking of something different. So, the message it is that when we encounter certain difficult situations, we have to think something different rather than going for something calculations. And what is the so-called difference in thinking? That one Einstein says, tie your happiness to a goal, not to any people or the things. When we encounter certain difficult situations, when we are about in the recovery phase, we have to tie up it with some goals. Now, the generic term it is that simplify, be a dreamer. Though I do agree in our personal situations when we encounter and when we about to bounce back, there are certain barriers, and barriers may be when we set the goal, the expectations could be imposed either by others or by our own. And definitely, this is social media constantly distracting you when we set the goals and we are not able to go for further. That is from stress to strength. Definitely, at times, social media could be a factor. Now, the time management. Always, we are finding time to invest for personal life when we target for the professional or something else. Now, I repeat the same question. When we invest these energies, we should tie the goal as per our passion, not people or things. So, something I would like to hear that we should have some kind of passion. I will explain you the professional when we discuss the professional dimensions. Now, the question number 2, it is that, yeah, do you believe you can grow positive ways by dealing with the difficult situations? So the question number 2 of brief resilience scale, that is the is talking about how to deal with the difficult situations. Then the answer will be definitely the fundamental answer that we need to acknowledge that I cannot change the direction of the wind. I can adjust myself to reach my destination. The point it is that, yeah, we need to adapt. And how this adaptation we can take place. So when we look into the literature, we can say simplify passive and active adaptation. Passive, simply we can say, yeah, I'll do walking, I'll share with my best colleague, I'll watch some movies, etc. And active, that means adapt. Yeah, we should have a positive or optimistic attitude, and we should search for the define of alternatives, and we should predict the outcomes, and we should try. I'm sure that in theory this is very simple, but in practical, high difficult. But let us think in some of the other way. One day, a person came to a with myriad of problems to a counselor, and he was asking him and he was sharing him many things, many things, right? And after 1 hour of listening this one, the counselor was not able to answer him a proper solution, right? And he was highly confused what to answer him, because he's thinking him as a great counselor, and after 1 hour what to answer he doesn't know. Now finally the counselor replied, I'm sorry sir, I have listened to you, I wasted your 1 hour, but during this 1 hour I'm not finding a total solution to the question you are asked, how to deal with the current difficult situation. I'm sorry sir. Now you will wonder that the participant, the counselee, replied that, sir, you have spent me 1 hour, that itself given me some of the other way to vent out my feelings. Whatever it may be, some of the other way I got some relief. The point I would like to highlight here that practically I felt that whatever the passive or the active, whenever we deal with difficult situation, try to share with the best person. That is the message I would like to convey here. Now, when we deal with this difficult situation, I found nearly 5 points. That is, do not suppress, instead to share it, which I already convinced you. And we should be highly flexible, and we should be adaptable with the current situations. And there is more chance of damaging the relationships, because I'm sure we are in 25, my participants are in 25 to 35 years of age. So when we encounter difficult situation during this period, there is a higher chance of damaging the relationships. So try the level best to avoid it, and try to be dependent. Don't feel inferior to seek for help. And always in the motivational videos, motivational classes, we used to hear that present is the only reality and past exists in the memories. We have to focus on the reality. So very easy to say, but difficult to answer in the practical situations. But let me give some of my own personal experience with a story. The story is talking about a blind man carrying a lantern. When a blind man was leaving his friend's house, the friend handed him a lantern to take on his way. And the person replied, I don't need a lantern. It's all the same to me because I'm blind, whether it is dark or light. But the man replied, I know, but if you don't have a light with you, someone might accidentally run into you. And he replied, oh, maybe the person who is telling me, it might be writing. Oh, all right, I'll take this. And he started his journey. On the way, he had a clash with another guy. And he was highly frustrated, and he asked, can you see a light right in front of your face? Then he replied, hey buddy, your light was already out. Why you are blaming me again and again? So the message from this story we are getting that using another person's ideas to enlighten other people is like the blind man carrying a lantern. The light may go out along the way and you will never know. Yeah, this is the Chinese story, but my message it is that to reflect when we encounter the difficult situations, people may come and go, but you should listen to the one who made you understand who you really are. I repeat the same sentence. We should listen to the one who made you understand who you really are whenever we face some difficult situations in our life. Proceeding with the second part, let us go for some analysis. I'm sure that all of my viewers are listening to me. Yes or no? Anybody can say yes or no?
Yes, sir. Yes, sir.
Yeah, good. So let us go for one exercise. Here I have mentioned many things. One is living status, friends, spirituality, family, ambition, sleep, finance, travel, adventure. Many terms are here. Now, my duty is to ensure you that kindly select. It is just an exercise. Don't take any paper and pencil, nothing. Among all these words, you select which is the most influential on my personal happiness. I repeat, in the beginning slide, I told you that we always learn about, I want to be settled in UK, abroad, etc., in AIMS, whatever it may be. But the query comes, all these things will give us perfect happiness. So let us have a introspection towards ourselves, whether living status, whether my friends, whether my family, whether my career, my sleep, my finance, my travel. Among them, which one is most influential? Kindly select the first 5 things which you feel highly important for your personal happiness. Did or not? Anybody? At least one candidate. I should be highly grateful. Have you selected any of these 5 which you feel highly influential? I'm sure in webinar you might be doing many things, but I'm taking 5 minutes from your side. Anybody selected 5 things from these words?
I hope everybody
Say,
selected, sir,
okay, fine, good.
because I
So moving
selected.
to that is good. Now we already selected it. Now the question number 2 it is that how much important are the listed items in your life? One, maybe you have chosen the family, career, or adventure, etc. So we have to give a score. Number 1, how much important? If it is highly important, give 2 marks. If it is somewhat important, give 1 mark. Nothing important, give 0 marks. Just to give 0, 1, 2 aspects. Since it's a webinar, I'm not going too much indulging into it, but let me go further. Now, the point which I am again highlighting, all these are you getting satisfaction for the listed items? That means we have listed certain things. None, yeah, career, academy, etc. So if you are getting the high satisfaction, you can give 0 marks, the listed items. Then if it is getting somewhat, then give 1 mark. Then very much, you can give 2 marks. I'm sure out of this 60, maybe 6 might have done. I should be highly happy. No problem. So now let us calculate A and B. That means our importance and our satisfaction. And you won't imagine our smallest scores are your biggest priorities. Anyway, I'm just showing my calculation which I did. I selected out of this, my family is the thing which I feel considered as highly important to me. Now I'm highly satisfied with my family, so my score is 4. Now, secondly, my second option was my career. I feel it is highly important to me, but with the current designation, always we never ever satisfied with our career because we are keep on crunching towards something else. So I kept score number 1. Then I calculated 2 marks for it. Finance, again the same criteria, workplace environment, etc. But I feel spirituality, I kept it as an important point, but I'm not getting satisfaction because everybody is in search of some of the other way identity. Spirituality, I'm not at all talking about religiosity. I'm talking about spirituality, the peace, the search for peace in some of the other way according to our vocations. So in that my score is 0. So what I feel that I need to focus more on the so-called spiritual dimensions regarding the way of life which I would like to live. So similarly, you can have an analysis of yours, the smallest scores where you're getting, there you have to invest more, right? So with this, I'm moving towards the second part of this one, to reflect. I told only 3 things in this half an hour. Number 1, when we travel from stress to strength, we should take some healthy breaks. These healthy breaks may be try walking, maybe meditating, exercises. And you should take some enjoyable breaks. Always and always work. That doesn't work. You should take some short breaks. See, today is Saturday, it's a weekend, so let us go for a movie or whatever it means. So some enjoyable breaks, it's very important to travel from stress to strength. And the third point, yeah, absolutely, turn off the distractions. We should definitely, that third point I will be highly highlighting you, whenever we encounter the situations, we have to focus. We have to focus that the so-called turnout in the distractions are very important. Moving on to the professional level. Till now we were discussing about personal. Let me go for professional, and hope around 12 o'clock, we are reaching 12 o'clock. I promise you 12:15, I'll wind up my session, but I need your full support. I believe that you will be giving me the upcoming 15 minutes, right? When we think about the professional level, always and always we used to hear a word which is called as burnout. And the risk of burnout unmet, and which I felt, this is all my presentations reference I'll show you at the end. So risk of burnout, unmet huge demands as per the settings, right? That is the reason which I felt. And maybe from the lack of the support from the team also. So when we think about the professionalism, we have to focus that from the stress towards the strength, where should I focus? From the stress towards my strength in the professional level, where should I focus? So we should identify the factors of professionalism. Number one, self-regulation. This is purely theory. Next slide, I'll be giving you the practical sense. Next one, we should be self-determined, then only the professionalism will take place. We should take the responsibility as well as accountability, then only the so-called professionalism will take place. And whatever the profession we choose, that should provide economic security. Why I'm giving this example, many of my students, my colleagues ask me after getting into nursing, should I change the stream? Should I go for psychology, MA, MPhil, etc.? So the point I would like to highlight here, we should search for the economic security. Our profession is the only one which I feel, apart from the other art, behavioral sciences, which is giving 100% economic security, right? Now, when we search for this so-called from stress to step level, we'll search for some professional identity. And we'll have some challenges also. Number one, based on the gender. Maybe because of your female, male gender, you are not able to, we can say that professionally identify yourself because the gender bias. Then education is also sometimes makes some poses to propose our identity in the profession. Sometimes we feel that am I which level, maybe a staff nurse, a nursing officer. If I after completion of my PhD, also after completion of a MSc nursing also, if I go for because my job is again giving injection. So where is my professional identity? Yeah, definitely we may feel the relevance as being a male. I felt many times the chances of getting into selected is, maybe because of the fact that male. So let us select a female. So that also sometimes because of the tradition we have, nursing is for female. So that also makes us have as a challenge or hurdle in search of a professional identity. Here I found 4 solutions. Those who are listening to me, my humble submission, take this only 4 points. Whenever we have to make an identity in our profession, number one, we have to develop a personal philosophy. Number 2, we have to involve in our professional associations. Number 3, definitely we should strive for advancement. I told you in my career, my satisfaction is only 2. Sorry, only out of 4, it's only 2 because, definitely we are striving for advancement. Do we have a professional image which is done through publications and our achievements? So I suggest these are the 4 things which will guide us to give us an identity. Now, definitely those who are actively listening to me, sir, this seems to be purely theoretical. It is not practical, sir. Something you're talking about personal philosophy. What is your philosophy, sir? And what is your involvement in associations? And what is your own identification in publication and achievements? Let me share my own history, my own journey from stress to strength, little bit. Number one, when we think about this from our classroom lectures, we learned that we should be smart enough, right? The same thing I am highlighting here. When a person, right, starting our journey in nursing, we have to tell them, to resilience, to in search of identity, professional identity, we should set a smart goals. The smart goals, number one, we need to identify what is my priority. In the sense, to me, I say that I should identify, you should identify which area I am having strength. Maybe in the clinical area, maybe I should be a good orator, maybe I should be a good researcher. So that strength, that priorities, we have to identify. Number 2 question, is there any measurable benefits? those who are in search of professional identity in our profession, when we select the goals, then we should keep on writing, keep on reading, keep on joining for courses. I should be telling you one thing. One side there is a candidate who is doing BSc, MSc, then PhD, then along with that he is doing MSc in we can say psychology, sociology. Keep on adding his courses. Does that give him a measurable benefit? To my experience, never and ever. It's only add his idea. Number three, what is the so-called goal he has set, whether it is a long-term or a short-term. Always we should set for a short-term goals. Don't worry, I'll explain you in the next slide. And the last, second last, result oriented. Try to find intrinsic reason and focus on that. Yeah, definitely whenever we set the goals, our focus is on outcome measure, that we call it as outcome. That means whatever I do after 5 years, after 4 years, will it give me a proper answer? Definitely the answer will be, we could not say anything, and the time based also. Out of the SMART goals, I again acknowledge that you won't believe, you won't agree with the point which I highlighted here. So let me ask you one question. Someone of you, I'm not saying out of 60 by 60, many, maybe one or two, might have asked this question in your life, encountered. So could you give me 5,000 increment in my next salary? That means a nurse, suppose a nurse who is working in a clinical site, a nurse educator who is working in a, we can say that just like your Anjanaya Trust. Yeah, after working for more than 3 to 5 years, definitely we have a responsibility to ask that, could you give me, because I worked here in this hospital or unit for more than years, I need a 5,000 increment in my next salary, so could you give me? Never. Many a times we might have asked and we might have expected, right or wrong. I believe strongly out of 60, 6 or 5 might have the wish. Let me tell you one professional example in which I encountered a person who had this similar question, and the question was that nearly, if I'm not wrong, nearly 5 to 6 years before, he had this question. I'm talking about not Bill Gates or something else. A person who is very genuine, which I found, and he asked that to his employer, "Sir, I worked here in your institute many years. Could you give me some years?" And the employer completely, as usual, completely denied. No, I have many other responsibilities. Admission is very less. We cannot give you, we cannot. The only thing you can assure that you have a job here, my dear. You have a job here, so you have to survive here, right? And that answer insulted or triggered the so-called personality which I'm trying to convey here. That triggered him a lot. And naturally speaking, he has two options. I told you, setting a SMART goal, right? He tried for AIMS. I have to change the college from here. Let me go for AIMS. With his hard work, he tried his level best to get the AIMS, many AIMS, but he didn't get, right? And he tried many of the other ways. That also he got failed. Then the SMART goal is not helping him, right? Now he had another thinking in his mind. If no one is helping me, it is me. I repeat, I want to change the direction of my weight because the other people are not helping me. And finally, you won't believe, he simply made a team nearly 4 to 5 years before. And I'm talking about this person. Currently, he is running his own publishing company. And I'm not at all as a, can say that a propaganda of this publisher, etc., or publishing company. The point I would like to highlight is that I support him, especially in the sense, in his difficult situations, he made some challenges and he proved himself that being a nurse, he can give a direct income to the government of India by giving the direct taxes. And You won't believe me that many aims rejected this man, but he is giving more than 50 employees across the country by his own directly produced webinar. Once again, I'm putting a disclaimer that I don't have any conflict of interest with this publishing agency, but I repeat the same line here in the sense when I encountered many difficult situations in my life, right? Getting selected in many of the places. He was the one that I'm not about publishing company, the person. He helped me. That means we should not forget. People may come and go, but we should not forget the one who made you really understand what you really are, right? He just advised me, don't go for so-called publishing company. You are for aims, my dear, and you try the level best. You won't understand. Imagine after my 10th attempt, now I'm in this aims Vidinagar. This was my nearly around 10th attempt, and he was one of the person who influenced me without an hesitation. I'm sure now also he is running behind his vision and goals, right? To highlight here, it is that whenever we face some difficult situation, we should have a plan A, plan B, and the timeline should be very clear and time-based. If it is not getting, the one is not getting, and definitely we have to search for the next one. Now, when we go for the smart, we can say that smart goals, setting the professional levels, we have to see what to go for and where to go for publications and all. So, what to say in the sense, we have to, many a times, the question comes, what to publish? Because I'm an image in my profession, right? So we have the option that we can do research in systematic reviews, we can do research in randomized controlled trials, and non-controlled, that we call it as in our language, quasi-experimental studies, observational studies, and case series. So first duty, what to publish means we have to select what I should prefer. Am I eligible to write a systematic review? Am I preferring for a randomized control? So that selection that we have to do in order to stand a professional image in our profession. Now the question comes, where to publish? Definitely many people, after preparing your own manuscript, many people will come to us, will say that, sir, you give me 2,000 rupees. Just you give me 2,000 rupees, I'll publish your work, and we call it as predatory journals. So don't prefer for any predatory journals. There is no use, and there is no professional image in that. Instead, our professional go for predatory journals, I think more than 10, 11% together and getting published. So there is no use. In order to get for our own image, don't go for predatory. And how can you understand that one journal is predatory? A journal which will give you within 1 month, within a week, immediate acceptance, and there is no plagiarism checking and fake editing and fake. The journal site itself, it will be showing it, it is impact factor of more than 5. My dear all, try to understand, a modern journal is having 0.5 to 1 impact factor. And how these predatory journals can claim they are having an impact factor of more than 10. So that could be we should be highly careful in that and market with the false credentials. I can give you that we may claim, my study is published in International Journal of Advanced Medical Care. The word international doesn't mean that the journal is international. It is a fake credentials. So we have to see that when a journal is putting with the so-called international, the brand, fake brand, we should search for the next time whether it is actually international, it is there or not. That we will be getting from it, going through the students are my strength. Whenever any students come to me, I am giving him or her a promise that your study will be published in an indexed journal without any article processing charges. I'm very gratefully and happily I can say that my students, their study got published with their name as the primary author without charging any fees and with our collective efforts. So in that sense, I tried my level best to give my students as a professional image, and definitely I'm 100% sure that some of the other way you will also you might have done. I'm sharing my own experience here. Now, this is my sense of identity. This is not about my student. This is my. I started my career 2013 MSc, reached from 2014 to I have not updated 2024. What I'm trying to convey that I have done a great thing. Never. I am in search of an identity in my profession. You can see that I am working exclusively on my area of interest, that is addiction psychiatry, right? From 2014. The point I would like to highlight you each and every an identity, whenever you see strength in our profession, select which you like most and keep on working. Forget about the outcome, think about the process. Some of the other way, this process will take you to some of the other levels, right? So I should say that there is no monetary benefits, but I can say that now I'm here in this institute. It is one of the other reasons one reason should be my image as a professional in terms of publication. Absolutely. Now, when we strategize for some bounce back, I'm trying to say 4 things, right? Whenever
Sir, your mic is at mute.
okay. Now it is audible.
Yes. Yes, there is some background noise.
So till now it is audible, not audible.
Yes, it is audible.
Okay, fine. So this is the problem which we that we need to understand when we try to bounce back. So when we think about this, examine our self-talk, living in the present, the point which I would like to highlight is that some circumstances are beyond our control, and these situations are only. I'm just giving you one story regarding a young man who is having this problem. That means he was having in a village, he was searching for a job, and he got an old man, and he was asking him, could you help me to go to the next village? I repeat, the old man asked this young man, could you help me to go to the next village? Then he said, yes, I will help you. And this young man asked, sir, what you will give me if I go towards actual sum. So then this old man asked, I have 3 bags with me. Kindly take 1 bag, right? And I'll give you some gold coins. Then this young man agreed, definitely, sir, I will help this bag. And they both of them traveled together. When they reached towards the shore, a seashore, a stream, the old man again asked, could you take my second bag also? Because I'm very old, I cannot take this bag also to this river. And this young man replied, no problem, sir, I can help you. But the old man having some doubts, and he said to him, see, all these bag is having full of gold coins and bronze coins and silver coins. I'm very old, so don't betray me. Don't take this. I'm trusting you. Please go ahead. And this young man replied, yes, sir, you can trust me. I cannot because I am a very honest person. I won't do anything. Both of them travel together. Finally, they are about to reach the destination, that is the village. But they have to cross the hill. And the old man replied, yeah, I have one more bag with me, which is a gold bag. And it is very difficult for me to take this bag also. Could you take this gold bag with you? So you are having with now bronze bag, gold bag, and a silver bag too. Could you help me to go out of this? And he replied, yes, sir, I can help you. So I'll go fast, right? Because you are late. So let me go, but you should trust me and you should let me go further. And he started the journey. So old man, very as the name indicates, he cannot go fastly the climbing, right? He started very slowly. And this young man about to cross the so-called mountain slowly. While his journey, he thought about this old man will come very late. I'm having full of wealth, which is gold and bronze and silver, everything. Why to be too much honest? Let me take this money full and take this. I can build a house, many other things. He ran away. Finally, he reached his house. And when he opened the bags, he found it was full of stones. Both these 3 bags with a letter that I was searching. I am the king of the land. I was searching for an honest man to be as my successor. The young man was highly depressed. That was the topic which we were discussing today. Yeah, this man, in our day-to-day life, we believe that, yeah, I'm very honest in my life. And some of the other way, when the peak moment comes, though we resist everything because of our own personal problems, or at a momentary, we fail, right? And think that we are almost gone. Now, during these situations, right, the story ends here. That means the man feel highly guilty that, yeah,
Excuse me, sir.
wasted.
Excuse
Yeah.
me, sir. There is some background sound is there.
Is it too much hurting?
Some background sound
Okay.
is disturbing. Loud voice. There is some background sounds that is disturbing your voice.
It is audible.
Okay, sir. Continue.
Slide also visible.
No.
Slide is now also
The
not.
voice is still there in the background voice.
Okay. There is some issues which is nearby to the office. So I'm right.
Yes, sir.
So the slide is visible. I'll conclude in 5 minutes. It's okay.
Yes. Slides are visible, but some voice is disturbing from behind.
Now it is okay. Okay, type.
Yeah, it's okay. Good.
Okay, fine. So the point I would like to highlight here that when we face certain things, the self-discipline. This man has the problem was having with the self-discipline, which is a manager of self-control and self-direction. So we highlight here that, yeah, if a person was able to control himself or the other way, he could have win the success of the kingdom. But my own version is giving you to control of self-control. That means I'm just, many of might have heard about this mind philosophy. That means some part of the mango, if you're getting this one, we have 2 options, either to throw it out or to take the best one. Similarly, whenever we face the difficult situation, the point I would like to highlight here that we have to ignore, we have to forget something, and we have to take the best. So that some kind of control, and this is, we call it as absolute control. It is not even possible with human. Some modest control we can take it. Now the second one, how can we direct ourselves? To me, I found this by lines by self-direction, the line by Abraham Maslow. That means an artist must paint, a poet must write, if he is ultimately to be peace at himself. My point is that we have to identify our own secret coins. That means the strength we have, that Maslow called it as self-actualization. We can call it as our own secret coin. If we identified the realization of our own caliber, our own potential, then definitely when we tired, we go for sleep. When hungry, we go for eating. It doesn't mean that we are not striving towards the destiny. We will balance each other. That we call it as the so-called self-direction. So both the self-control and self-direction, if you're able to attain it, definitely we have a self-discipline that is equal to the so-called the journey crux from stress to strength. Now, this is my, I'm sure my audience will be highly happy with the last slides. During this journey from stress to strength, this sentence, I had this sentence during my days. I do not know when the day will come, but I am highly sure that it will come someday. So do not stop walking forward, even if the speed is very low, because whatever the things which I shared here, that experience is always a light towards the destiny. And I am hearing, expressing the lights of my own experiences. There is no differences in this regard. Thank you so much for the kind listening. I'm sure that I tried my level best, but if you have any query, most welcome. And at the outset, I'm giving once again the thankfulness for this organizers for giving me this opportunity. Now it is open for the discussion.
We are incredibly grateful for the valuable knowledge you have shared with us, sir. Thank you. Now the session is open for discussion. Those who have a question can unmute the mic or raise the hand and ask a doubt, or put your doubts on the chat box. Others kindly mute the mic. You can put your question in the chat box, or you can directly ask with the person. Anyone have any queries?
I think no one.
I think no one, sir.
Okay.
Once again, thank you, sir.
Okay.
I think we can conclude this program.
Okay, ma'am.
Okay, thank you, sir.
Shall I leave the program?
Yeah. All participants kindly note the webinar feedback from link is shared in the chat box. Please fill up the form for getting the e-learning certificate. Participants, once you leave today's webinar, you will receive a feedback form of the presentation, and we would appreciate if you could complete the survey and provide your feedback. You will also receive e-learning certificate. On behalf of Sri Anjanaya College of Nursing, thank you for joining with us today, and have a great day to all. As we came to the end of this insightful and encouraging webinar, it is time to express our gratitude to all those who have contributed towards success. To deliver word of thanks, I would like to invite Mrs. Lima John, Lecturer, Department of Mental Health Nursing, to extend our heartfelt appreciation. Welcome you, ma'am.
A pleasant midday to all. On behalf of Sri Anjanaya College of Nursing, I would like to extend my heartfelt gratitude to each and every one of you for joining us today for this insightful and engaging webinar. First and foremost, I extend our heartfelt thanks to our chairman, Mr. V. Anil Kumar, and Secretary, Dr. Sudha Anil, for their selfless support and adorable inspiration throughout the organization of this webinar. I want to express our sincere appreciation to our eminent speakers, Dr. Vinil V., Additional Professor, Department of Mental Health Nursing, Mahi Manipal, and Mr. Jason Joseph, Assistant Professor, College of Nursing, AIMS, Bibinagar, Hyderabad, for sharing their expertise, knowledge, and valuable insight with us. Thank you both of you, sir. Your contribution have truly enriched this webinar and provided our audience with invaluable information. Our heartfelt thanks go out to our honored principal, Dr. Professor Jorli George, whose unwavering support, meticulous planning, and execution have played a significant role in the smooth running of this webinar. Thank you, ma'am. Next, I would like to express sincere thanks to our beloved Vice Principal, Professor Regati, for her immense support and guidance. A special thanks to all participants for your active participation, thoughtful questions and contribution to the webinar. Your engagement has made this webinar a dynamic and interactive experience for everyone involved. Then I would like to express the sincere thanks to our IT department for their technical support throughout the webinar. Thank you, IT team. I would like to acknowledge the hard work and dedication of the organizing team behind the scene. Mrs. Adulya Kevi, Assistant Professor, Mrs. Salsana, Lecturer, and Mrs. Limajon, Lecturer, Department of Mental Health Nursing, Psycho. I am very much thankful to all my colleagues and staff members who always stand by us and motivate us. I feel proud and thank you Almighty for your making this event a successful one. As we conclude this webinar, let us carry forward the knowledge and insight gained today into our respective endeavors and continue to strive for excellence in our fields. Thank you once again to everyone involved and look forward to your continued support in future endeavors. Have a wonderful day ahead. Thank you.
Now we will wind up this session. We will meet again soon with another encouraging session. If there is inconvenience, we are sorry for that with the sound and inconvenience. And we will again meet with an encouraging session. Thank you all. Thank you.